Infants could have an elevated risk of developing type 1 diabetes later in life if they were transitioned to solid foods prior to turning 4 months of age. This is according to researchers from the University of Colorado and reported in the journal JAMA Pediatrics. The risk also appears to be greater if solids are introduced after the baby has turned 6 months of age. The authors claim that infants who are still being breastfed while starting on solid foods have a reduced risk of developing type 1 diabetes, especially if those foods contain barley or wheat. Lead researcher Jill Norris claims, for children who are introduced to solid food before 4 months of age, the risk of developing type 1 diabetes is almost 2 times higher than for children introduced to solid foods at 4 or 5 months of age. For the study, Dr. Norris and her team collected and assessed data on children with a heightened genetic risk for type 1 diabetes. The researchers looked at when solid foods were first introduced, what foods were consumed, and whether the child went on to develop type 1 diabetes. Dr. Norris claims that the study results suggest that parents should wait to transition their baby to solid foods until after the 4-month birthday. When the baby is ready, solid food should be introduced by the 6-month birthday or soon after, preferably while the mother is still breastfeeding the baby, which could aid in lowering the risk of type 1 diabetes.